good evening and hello and welcome everybody out there. Today is March 26, Saturday, 5 p.m. Welcome to another episode of live broadcast for Your Health Today with Dr. Soliman. The last session we spoken about ADHD, which is Attention Deficit Hyperactivity Disorder. Today we're going to just touch up 5 minutes on that subject, then we'll move to the next subject, which is very important topic, male impotence. So remember what we said the last time about the attention deficit hyperactivity disorder. As the name suggests, the boy or the child cannot focus on doing anything at the time. He has to be jumping from one place to another. Hopefully we'll have a video to play after in a few minutes or so. The child will be jumping from one place to another, or in other terms, you cannot leave the child alone for a minute because he will be grabbing this, destroying that. He cannot just stay quiet for 1 minute. The teacher will also be complaining about the child, grades are dropped. He's always distracted. The easiest, the smallest thing is distracting the child. That is by definition attention deficit hyperactivity disorder. And sometimes the child does not speak for few months to years late. And the reason for that, like we explained the last time, is that child has so many things to do in his head. So he does not have the time really to answer you back when you talk to him, because there is a list of things to do in his head, and he's basically confused. Which one do I do? Do I do this, or do I do this, or do I do this? So the minute he jumps to catch the key or to play with the key, he remembers, no, there is a TV there. He remembers, no, there is a ball of something there. He remembers, no, he has to slap this. He remembered. So all those things that he has in his head confusing him to a degree that he does not know what to do next. So if you talk to him, you have to distinguish between somebody who is deaf, he cannot hear, and somebody who is ADHD, and somebody who is autistic. Those are three different things. Basically, if you call your child name and the child answers back or looks at you, that means the hearing is okay. The child hears you and he looks at you. That means he already recognized that this is his name and I'm answering back. Okay? So now, autistic child, a deaf child will not hear, period. An autistic child will give a sign that he hears, but he's not interested in what you have to say or what you have to do. An ADHD, he is too busy. He will give a sign that he is not deaf. He will give a sign, you will get his attention when you call his name, but this is for only a fraction of a second, but he will go back to his own agenda, the things that he's confused about what to do next. Let me see this video, and then maybe we'll have a clearer picture on what is ADHD all about.
So you cannot stay in one place. You always have to touch something. Yeah? You cannot focus. Hey, how are you? What do you want? You want my keys? Huh? You like my keys? Huh? He does not speak yet.
Yes.
Huh?
At the age of 3.
At the age of 3. And he's always on the fly. He's always distracted by something, correct?
Oui.
All right, we know what the problem is.
À l'école. À l'école. La maîtresse, c'est quoi? À l'école, sa maîtresse dit qu'il est...
So you see in the child, he's all over the place. And this is now his first time in the clinic, but he got adjusted so quick, and now he has to go and explore everything, touch everything, because that's what is in his head. And by the way, we've spoken also about ADHD does not happen only in small children. Adults can have it, men can have it, women can have it. It just presents differently. He will also be confused, meaning that's, for example, if you're a student, you know that you have an exam in a couple of days, but you don't know what to study first. You are, like there is a lot of things to do, but you cannot focus. The treatment is very simple. Just a couple of medication that you will take and a few sessions of therapy, and he will be fine. The medication takes effect after about 2 weeks. After about 2 weeks of taking the medicine, not immediately. You will see improvement, but major improvement in about 2 weeks because of how the drug behave in your body. Okay, not like every medication has a different way to behave. Now we're gonna move now to the most interested topic that a lot of people was asking about to discuss, which is sexual weakness. Sexual weakness and impotence, male impotence. And then if you please can show me the video and then we discuss.
Okay, you tell us again, what brings you to Dr. Soliman?
About inflection of when I'm making love. My girlfriend had discharged very fast.
Your girlfriend saying you discharge very fast?
I feel it.
You feel it? Okay.
You don't stay.
Did she complain?
Yes.
She complained that you reach your orgasm before she reaches her own.
Yes.
And how long since this problem has been going on? For how long?
1 year.
1 year. Before the 1 year you were fine?
Yeah, before
You
1 year.
were with the same girlfriend?
No.
Was a different one?
Yeah, no.
That previous one didn't complain?
Uh-huh.
The previous one didn't complain about this discharging very fast?
The first one,
She didn't complain?
yeah, by that time, I don't know, it's just that I was not having the
Desire.
reflection.
Did you not have that problem at first?
Yes.
Okay.
Let me ask you a couple of questions, okay? In the morning when you wake up, do you have an erection?
Yes.
Is it a strong erection?
Mm-hmm.
So now when you say you discharge very fast, is this the first time or the second time? So, sir, we're doing the ultrasound now, and this is the right testicle. And the right testicle will show also a little bit of microlithiasis. This is microlithiasis here, the shiny spots. So we have microlithiasis here in this testicle. Okay, a little bit of fluid, but there is no hydrocele, there is nothing there. So it looks okay. So now doing the second testicle, we'll see microlithiasis all over the place. Microlithiasis, this is shiny spots, this is all microlithiasis. Okay, so this is what we found in this man. This is a second case today only with the same problem. Okay, thank you very much.
All right. So, by the way, that's a young man, late 20s, early 30s, something like that. Okay, and that was the second case in the same day with the same problem. So let me tell you something. This problem, sexual weakness among men, about 33% of the population have it, of the male population have it. Okay, it can vary from one country to another, but we very much stay at the same, percent. About third of the population, male population, have sexual impotence. A lot of people do not like to talk about it. A lot of people do not like to expose it. They feel a bit shy or taken away when they come to a clinic and discuss such a thing. And we're talking about young men. It is understandable, even with older men, they should not have sexual weakness. When you get old, the sex is there. The power of sexual erection is there. Things just get a bit slower, but nobody should have a weak erection. When we have a weak erection and sexual weakness, it is for a reason. It is for a reason. But normally, nobody, even if you're 200 years old, you still should maintain your sexual power and you still should have a good erection and enjoy your sexual life. Only difference between a young man and an older man is the duration of the sexual intercourse. Older people take a bit longer than younger men to reach orgasm. Now, that is the normal. So do not, have the false belief that, oh, I'm old and it is normal for my sexual power to decrease. And I'm old and that is normal for me to have weak erection or no erection. The general rule here that applies perfectly to sexual weakness is use it or lose it. Meaning, if you do not use your sexual organs, over time, you will lose the capacity and the power to use them. It's just like an exercising muscle. When you exercise your muscle, it grows and it's functional. If you do not exercise, then you will lose the functionality of that muscle. The same thing applies to your sexual organs. You understand? So if a man out there does not have sex, with time, he will lose the sexual power and he will get sexual weakness, because that rule applies. Use it or lose it. Let me just give you a small background about sex and the sexual power for men. A lot of people think that sex has to do from the waist down, below the waist. Sex is all about what is below the waist. And this is wrong. This is a part of it, the smaller part of it. The bigger part of the sex is actually what is above your shoulder, the head. It's all about your head. So, if you need to have a good sexual power and health, you must be very clear up in the head. When someone wants to have erection, you must be in a relaxation mood, or what we call it in medicine, parasympathetic mode. Forget about the fancy names, we're not going to use them. You have to be relaxed. In order for me to have erection, I have to be relaxed. The opposite is not possible, meaning the opposite of relaxation. If you running for your life, somebody chasing you, or you are afraid of something, or you fighting somebody, fight or flight state, can you possibly have an erection? Less likely. I don't think so. So that means, number one, we have to be relaxed. Relaxed meaning we are stress-free. And some people don't understand the word stress. Stress meaning a disease, that's a stressor. Constipation, that you cannot stool for a few days, that's also a stressor. Emotional stress, you're thinking about income, what I'm gonna buy tomorrow, what I'm gonna get money from tomorrow, how I'm gonna deal with the wife, how I'm gonna deal with this, how I'm gonna deal with that. This is all stressors that adds up and deviate your mind from the relaxation mode. So again, in order for me to have erection, I must be in a relaxed mode. If your finger pains, that will interfere with your sexual capacity and power. So we have to eliminate all the stressors. We have to be in a relaxed mode to have a good sexual life. Is that possible? We try our best. Nobody is free of stress. But I'm telling you, when you stress, when you have an organic disease, even constipation, that will affect your performance during your sexual behavior with the wife or with the sexual partner. Now, what we have seen in the video is a young man. Can young men have sexual weakness? Yes, we've seen them a lot. Why can somebody have sexual weakness? Yes, let's now talk about the mechanism of erection. How can somebody get an erection? You know, erection is about blood flow to the penis. So when the penis is erect, that means there is blood flow going to the penis more than normal when the penis is lancet. What does that mean? What kind of blood? Arterial blood. So that means there is another kind of blood? Yes, there is venous blood. Arterial blood is the oxygen rich, nutrient rich, and is the high pressure blood that is delivered by something called arteries. So we have an inflow of arterial blood into space inside the penis. And then what about the venous blood? We have to limit the outflow of the venous blood, meaning we have an inflow, something coming in, which is arterial blood. We have an outflow, which is blood going out, which has become now a venous blood. After all the nutrient and oxygen has been extracted from it, it becomes venous blood. So it goes to the veins. That's a low pressure system. So now, in order for me to reach erection, I have to increase the inflow of the arterial blood and decrease the outflow of the venous blood. That is mechanical. This is like plumbing here. Huh? This is plumbing. Nothing difficult. In order for me to get erection, I have to increase the inflow of the arterial blood, decrease the outflow of the venous blood. In this case, I will have an erection. The more the arterial blood going in, the less the venous blood going out, the stronger the erection. So we know all it's about the blood. So now let's find now why would somebody have an impotence. So if the erection is all about arterial blood inflow, then we have to see what can compromise that. Well, we have the heart. That is the biggest bump in the only biggest bump in the heart, the body that pumps out blood. So if somebody have a heart problem, like heart failure, whether is reduced ejection fraction heart failure or increased ejection fraction heart failure, forget about the fancy terms. If you have a heart failure, your heart is not working right. Can that affect the inflow of arterial blood going to the male sex organs? Yes. So that means will be less inflow of the blood going to the penis? Yes. Can that lead to weaker erection? Yes. So the heart has to be good. What delivers the blood from the heart to the penis is the blood vessels, the arteries, the veins. What if I have an inflammation or a disease in the peripheral vascular system? Will that affect my delivery of the rich, high pressure arterial blood into the penis? Yes. As a result, I will have a weak erection. What if I have diabetes? With a high cholesterol, that now the vessels that deliver this blood into the penis become narrower than normal. Will that affect the delivery of the arterial blood into the penis? Yes. So the patient then cannot have diabetes, long-standing diabetes, complicated with increased lipids, and talking about we're going to have good sexual life. No. So that means your weekly fasting blood sugar, even when you're young, you know, it should be done because those are small things that can easily be prevented. Because once we have atherosclerosis, which meaning decrease of diameter of that artery that deliver the arterial blood into the penis, close or partially closed or occluded with all those cholesterol and sugar when they combine together is horrible. Because it's like solidify, it's like this table here, very tough. So who can remove that? Nobody can remove that. Now we have fancy surgeries and fancy, procedures that so advanced that we can do revascularization of the male organ, the penis. We can do revascular, meaning what? We're going to bring new vessels and then we remove the old vessels. But is it done here in Africa? I'm not aware. And why would we go all the way far to do that if we can prevent it by something small in the beginning to live a healthy life all your life? So checking your blood sugar, checking your blood sugar has something to do with impotence. Checking your blood pressure has something to do with impotence, because again, impotence, sexual weakness, is about the blood that gets into your penis. So whatever carries the blood, whatever pumps the blood out, whatever responsible for decreasing the diameter of that artery that reach the penis and cause the erection, all of those factors are responsible for good erection. But you said hypertension, you said heart failure, you said diabetes, you said high lipids, you said all this, but we have a young patient here. How can a young patient, 20-something years old, suffering from all those diseases, one of them or two of them or all of them, this is less likely, right? And you're absolutely right. Less likely a man of this age will suffer from something like that. Absolutely correct. Then what is the problem? If he cannot have all those diseases, and you said this is the most common causes, or because it's about blood and what carries the blood and what delivers the blood and what pumps the blood, and this young man have a healthy heart, he doesn't have diabetes, he doesn't have peripheral vascular disease, he doesn't have high lipids in his blood, why then he is sexually weak? He's been for a year or two, to the point that his girlfriend has complained, it's not working for me. Let's define what is good sexual erection. You maintain good erection to penetrate and ejaculate after few minutes. Premature ejaculation, that's always another symptom that accompanies the sexual weakness. Premature ejaculation, like the name suggests, you ejaculate before time. What is time? We say 1 minute. So sometimes even people ejaculate before reaching penetration, or immediately after penetration. They don't finish 1 minute. So that's when we say premature ejaculation, we're talking about 1 minute. We're not talking about now, okay, I do 10 minutes, that's normal. So the definition is 1 minute. You ejaculate after 1 minute. From the beginning of the intercourse, 1 minute or less. That is premature ejaculation. But premature ejaculation is always something that is accompanied by the weak erection. So back again to the point, let's not deviate. How you explain then this young man having sexual weakness? Then we have to say this is psychological. If you have noticed during the interview with this man, I asked him one question. Early morning, do you have an erection? Yes. So you have a good erection early in the morning, but you cannot maintain the erection during the sexual intercourse. Now this is psychological. Psychological. Remember what I told you before at the beginning of the session? I said it's all about the head. You must be relaxed to have a good sexual life. If you're not relaxed, you cannot have it. And this is very common among men. Not very common. We said third of the population, and now young men are on the rise to have sexual weakness. And believe me, it is not organic, meaning it is not because of organic disease like we have discussed a bit earlier, just a minute ago. It is psychological. Can we have a solution for that? Yes, we can have a solution for that. It's very easy. It's no problem. What is the solution? We're going to do therapy. We're going to do therapy. Okay, meanwhile, we can jumpstart him with some medication to have the strong erection and to have the delayed ejaculation. Okay? Let me tell you something. Erectile dysfunction, weak erection, is a symptom of depression. When we talk now about psychological causes, the whole erectile dysfunction, the whole symptom of erectile dysfunction, it is nothing but one of the symptoms of depression. What is depression? Loss of interest. Among those interests is the sexual desire. He lost interest. So this is a symptom of depression. Does that mean everybody out there, young people, who have sexual weakness, can we call them depressed? Because they have lost interest in, not necessarily, but erection dysfunction, erectile dysfunction, is a symptom of depression. So how are we going to treat? Oh, we treat depression by giving a group of drug called SSRI. But what if I tell you that among the strongest SSRI, which is serotonin selective serotonin reuptake inhibitors, it's a group of medication. Let's call them antidepressant. Among one of the best out of them that we usually use, this medication that we use for depression can cause erectile dysfunction. So if the doctor is not careful and treating depression, he's going to actually worsen the sexual weakness. So what we do, you have to be careful in what drug to choose to take away the depression and maintain the sexual health. Because can any other drug, for example, a medication that is used for hypertension, the guy, he was fine before you put him on this medication, and then now that he's taken this medication, he is no longer able to erect. Talking about an older man now. So antihypertensives, some of the antihypertensive meaning the medication that treat high blood pressure. Some of those medications can actually cause erectile dysfunction in older men that are hypertensive. So what is the big thing here? When you see your doctor, you tell your doctor, doctor, I am not interested in a drug that will kill my sexual desire or cause me sexual weakness. I want a drug that can not interfere with my sexual health. And that will be great. Then the doctor will understand, oh yeah, it's supposed to be like that. If the man is still, sexually active, and nobody out there should not be sexually active, your sexual health is important, and you should maintain it. There is no reason for anybody out there to tell me I'm old and I cannot have sex, or I accept the fact that I cannot have sex. No, there is no such a thing. Such a thing doesn't exist. It's either somebody mistake by giving you the wrong medication that causes sexual weakness. So I treated the hypertension, but I caused sexual weakness. Is that good? Absolutely not. I treated the depression, but the guy now is, that's it, impotent. It's not good. Why? Because there is always alternatives. Meaning, instead of I giving you antidepressant that causes sexual weakness, I'm going to give you antidepressant that has nothing to do with sexual weakness. So we choose which one to give and which one not to give. So this is, let's now talk about how can impotence happen. Let's talk from the head, from the desire. The desire is where? In the head. When you have sexual desire, it happened from where? From the waist down? No, the waist down is just as a result of what's going on in the head. What is going on in the head? Desire. Desire has to do with the head, because all the substances that causes you to have a sexual desire for someone is in the head. You see something, you hear something, you touch something. Those are all stimulants that have stimulated some centers in the brain. As a result, some hormones are released. Those hormones will go stimulate the testes, and the testes will then produce testosterone. That is the substances, that is one of the most important substances, if it's not the only one, that is responsible for your sexual desire. So when a man comes to me and tells me, I have lost desire, then I already know that there is something wrong with testosterone. Then I will look at his testes. Maybe his testes are small, hypogonadism. Then I will look, what is the reason that your testicles become small? We'll investigate then the hormones that are coming from something called the pituitary gland. We investigate the hormones that is coming from the hypothalamus to stimulate the pituitary gland. We investigate the LH and FSH, luteinizing hormone and follicular stimulating hormone, and its effect on testosterone. It's complicated, but glands and endocrine and the head has a lot to do with it. Down the waist is only mechanical, and it responds to hormones. Those hormones is testosterone. Testosterone is responsible for sexual desire. Is testosterone also responsible for erection? Yes. Low testosterone, low erection. High testosterone, high erection. So that means it's good to take testosterone, right? Well, go ask those who are body builders, the exercise their muscles, and some of them, not all, they get so addicted to the big muscles, they want more and more and more. So what they do? They shoot testosterone. It gives you the muscles, it gives you strong bones. But what is the side effect? What is the price you pay? It's not going to give you sexual desire. You know why? Because this excess of testosterone inhibits and kills the testes not to secrete any more testosterone. Remember when I told you in the beginning, use it or lose it? Now I'm somebody who is taking external testosterone from outside, and this is an advice for those who shoot testosterone to build muscles. I'm taking testosterone from outside by any form, oral form or IV form. So I'm telling the testes to shut down, because testes only respond to low level of testosterone. Then it will secrete its own. But if I give it testosterone from outside, so I'm basically telling the testes, hey, I don't need you anymore. Stay aside. I'm already taking it from outside. And the monitors and the sensors in your body sense that there is testosterone in the blood. I don't need to secrete anymore. So based on the rule that said use it or lose it, I don't need to make testosterone. I become lazy, I atrophy, mean I become smaller over time till I disappear. So this is what we call hypogonadism because of external other causes, secondary hypogonadism. This is one of the examples. Can be the only hormone that can? No, there is another hormone called prolactin. I am going to tell you a story happened to like 2 months ago or so, okay? A guy came in, a young man, but this is not a sexual weakness. This is just, I remember the case because sitting in front of me, his eyes cannot see with one of the eyes, and the other one half and half, so and so, headache, and I looked at him and since when? Oh, long time ago. And what is going on? I don't know. Nobody knows. The man came, actually is very, not financially very, he's a farmer, Looking at the man and I examined the man and I realized it was prolactinoma. Actually, that's we're talking about prolactin. That's a prolactinoma that is pushing against the chiasm, which is the optic nerve, pushes the eye out, the optic nerve out, disturbing his vision. That can be only confirmed by something called an MRI or so, and we take prolactin level. Anyhow, we did the basic test, and we already know that is a prolactinoma. Just two small tablets will take care of them. Something to subside and shrink the pituitary or the prolactinoma inside the pituitary and relieve the chiasm from the pressure, and that took care of them. 2 small tablets and it's good. But you have to have now a neurosurgeon who shrunk the tumor. Now you have to go find a neurosurgeon to do the operation for you and take it out. Okay? But that is, we helped them with 2 tablets. And he's no more, the pressure on the eye has been relieved. It's okay. So now let's go back to prolactin. What is prolactin? And this is also for the woman out there. Very important. When your prolactin, that comes from the pituitary gland inside the brain, when your prolactin is high, that is inhibition of fertility for a female. And that's also inhibition for a male. How do I know? In a female, it's easy to know if prolactin is high or not. It's very easy. How? Squeeze the breast will come out, will show milky discharge, galacturia, milky discharge will come out. Now we know prolactin is high. Next step is to measure and give medication, shut down, and everything is solved. No problem. So if you suffer in infertility and you're female out there, squeeze the breast, see if the nipples produce some milky discharge. You know your prolactin is high. But can I do the same thing for men? Squeeze the breast and milky discharge will come out? Less likely. Why? Because women have enough estrogen, okay? And estrogen and prolactin together is responsible for showing the galacturia. When you squeeze the breast, the milk will come out. But in a man, he doesn't have estrogen. Unless it's a different case with gynecomastia and we have estrogen in the body, then the man will also show discharge from the breast when you squeeze. So there are also other hormones that can affect impotence, like prolactin, okay, which is an inhibitory to the reproductive system, male or female, by the same mechanism. By the same mechanism. Now, let's talk about something else. You know, any drug that you take in, let's say you are psychotic, okay, you are psychotic, you are not normal, and you give an antipsychotic medication, some of them cause sexual weakness. Have you seen before somebody on schizophrenia medication and sexually active? Less likely, unless the doctor is good and he reduces the dose and gives something that does not interfere with sexual dysfunction. Right? Yes. So I don't know if there is something else to cover, but let's take 1 minute break, and then we'll talk about what can we do. What can we do regarding sexual weakness? Let's take a minute. Let's take 1 minute break. Welcome back. So now we have discussed, I think everybody should understand. If you have questions, send me an SMS. Send me a WhatsApp. My number is there, 694-940172. I will be happy to read the message, but I don't think I'm going to answer anything today, except maybe next session or so. Okay? Yeah, so let's talk about the treatment. And we're going to summarize the treatment in 1 or 2 lines. Tablets. We give tablets that has to do with increasing the diameter for, tablets increasing the diameter for the arterial blood vessel that has to deliver blood into the penis. So those are tablets. And there are now many variety of tablets. There are tablets that can last you for 24 hours. There are tablets that can last you for a few hours. And now there is another thing also, which is injectable inside the penis. You put injectable that can last for an hour or so. And there is also now the vacuum. Remember what I have told you about the mechanism of erection? The mechanism of erection is to increase the inflow, decrease the outflow, right? We have a device called vacuum. I don't have a picture of it. Maybe I can supply it to you later. A vacuum, this is like a device. You put the penis inside, and you put like a ring, like a rubber ring at the base of the penis to constrict the outflow, and only with the vacuum you increase in the inflow, and you'll have an erection. It's a mechanical device, and then you will have an erection. And now, lately, they have an implant that you can put an implant, and this is actually have reached more than 95% success. Those are for men who they have heart failure, they have heart problem, they have diabetes, they have this, and reaching an erection is not possible. So now they do the implant, and they will have, and they control the erection by something in their waist, and then it's fine. It's working fine. Is working absolutely fine. But this is something that requires small surgery that to put the implant inside. A urologist can be very handy in this case to put this implant inside, and then the man even at later age can have good sex. We have another video, okay, we have another video to play, but we only have like maybe 5 minutes left. I don't know the length of the video, so I leave it up to the production for them to decide now. If you wanna play the video or close the session without the next video, it's up to you.
So this is the Becker cyst. This is in the right popliteal fossa. But to be 100% sure, we'll put the color Doppler, make sure there's not a blood supply. Okay. So obviously there's not a blood supply, so the next step is we're going to do needle-guided ultrasound aspiration of the cyst. Okay? That's what we're going to do. So we'll kill the color, and then I'm going to need assistant, somebody to hold the ultrasound, or I give the needle, to mark where I'm gonna go. Give me the needle. So, here, I go from here. But we're gonna edit this because this is too much. So stop it only when I tell you to start. Yeah, put it in the needle here. Okay, hold this for me. Hold this for me. And then we're gonna do this. Make it tilted like this till it. You see the needle going in? You see the needle going in? You see the cyst is decreasing? Almost to none right now. Okay, now put the video here. Put the video here. And this? Very small. You got it all. Thank you. Okay? So we can put it in the shoulders. So this is what we have taken out. This is ultrasound guided, but we didn't film with the ultrasound. We're going to do the next knee, ultrasound guided, and you see this is what we took out of the cyst. This is Baker cyst, and this is what came out of the cyst. Okay, so this is Baker cyst. And we suck in this. The fluids are a bit thick, so it's harder to put in the syringe. But we are sucking the fluid out of Baker cyst. Yes. It's coming? Huh?
Yes.
But we have to be very careful. We have the popliteal artery right there. It's coming?
Yes. As you can see, yes.
It's coming?
It's almost finished.
Yes, it's almost finished, yes. You see the needle? You see it's collapsing the place now. Okay, it's very much finished. Okay, we're successful. Here it is. That's the Becker cyst.
You see what I mean?
Okay. Okay, the needle going in. You see the needle?
All right, that's enough. Thank you very much. And this is a topic that maybe we're going to touch upon next session. This is somebody with a knee pain, especially on the back of the knee. There's something called Baker cyst, and you see, when you have pain on the back of the knee, the legs are heavy. There is very important diagnosis that a doctor can have to do, which is DVT, deep venous thrombosis. That clot in that thigh or the leg can travel up to the lungs, and that's deadly. So we have to eliminate this as a possibility by doing an ultrasound. Make sure you compress the vein. The doctors will know how to do it. Compress the veins, make sure it's not a clot. And the second possibility is that fluids that we collected because of maybe arthritis, maybe other things. But this is an easy way to take it out. We must take it out, and then we give an injection to the knee to subside the symptoms and take care of the arthritis. But here, the biggest differential diagnosis, meaning you have to be very careful and you have to investigate anybody with a pain in the legs for DVT. You have to be sure there is no clots in the legs, because one of those clots can make it up all the way to the lungs, and the patient will be at risk for pulmonary embolism, which clot in the lung. So any patient with a leg pain must be evaluated for a DVT. It's a must, especially if the pain in the back of the leg. Okay? Thank you very much. We're going to touch upon this topic again maybe next session. God bless you all and have a wonderful weekend. Thank you very much for listening, and I appreciate you. Thank you.